Welcome to SFCS Public Forum 2024. Let me welcome our president, Dr. Lim. He will be coming in to share with you our today's program. Over to you, Dr. Lim.
Hello, good morning. Good morning, everybody. Thank you for joining us this morning. It's a nice day out there when we all stuck in front of our computer screens. So welcome to the public forum on pelvic floor and continence, organized by the Society for Continence of Singapore. The Society for Continence of Singapore, or SFCS, has been around for more than 30 years. We are a charity, and we are an IPC certified charity, meaning that we are very tightly regulated by the government, and any donation that you give to us is very warmly welcomed and will also allow you tax rebates. Okay, our aim of the society is to help raise the awareness of continence and incontinence, actually, as well as the various methods of care and treatment for continence available to patients in Singapore. I'm not going to go too far into this. I'm going to hand it back to Ms. Jenny Lee, who is going to help to host today's event, to start with the first talk. Back to you, Jenny.
Thank you, Dr. Lim. Our first speaker is NC Xiao Yiqian. She's just come in, to our chat room. What I'll do is that I will go over to her and let her share how can I retrain my bladder. Over to you, Yiqian.
Hello, good morning, everyone. Thank you for joining us on Saturday morning. My name is Yiqian, and I'm the continence urology nurse clinician from the Tan Tock Seng Hospital. Today, I will be talking about can I retrain my bladder? Before I answer this question, let me explain to you our urinary system. From the picture, you can see we have two kidneys which produce urine and filter waste. Ureter transport urine down to the bladder to store and remove urine from the body. Urethra divert urine out from the body. So how your bladder works? The bladder's job is to store urine produced by kidneys. The bladder fills up gradually until the desire to pass urine increases. Then at the convenience time, you empty your bladder. The urethra is normally kept closed by a circular muscle, we call it sphincter, assisted by the pelvic floor muscle. As the bladder empties, the bladder muscle squeezes the urine out. The pelvic floor muscle relaxes and the sphincter opens to allow the urine to come out. How do you know your bladder is full? No message are sent between the brain, bladder, and the pelvic floor muscle and influence the sensation and control of your bladder. It means when your bladder is full, they will send message to your brain to tell your brain your bladder is full. Then the brain will tell you whether you can go toilet or not. Example, if now you are in a classroom session or you are in a meeting, your brain will tell you, no, you cannot go toilet, you need to hold. But if now you're free, the brain will tell you, oh, now you're free, you can go to the toilet. So think of the bladder as a balloon and sphincter as a knot. The bladder is an elastic muscle that stretches to hold urine being sent from the kidney via urethra. Because the bladder is controlled by muscle and the brain, so it can be trained. You can retrain your bladder and learn good peeing habits at any age. While training the bladder and the sphincter muscle is more challenging than working out your quadriceps and biceps, it can be done. We call it bladder training or bladder retraining or bladder re-education. So what is bladder training? It is a risk-free behavioral therapy. You can try it on your own or with the guidance and the support of a health professional. Because bladder training is a low cost and a low risk, your doctor may encourage you to try it first, even before specific diagnostic tests are performed. The aim is to teach you how to control your bladder instead of your bladder controlling you. This is done by eliminating bad habits and introducing good habits to help control your symptoms. Bladder training programs help you to gradually increase the time being visit to the toilet. help to increase the amount of urine your bladder holds and help you to control the feeling of urgency when the bladder contracts unnecessarily. The training helps you to understand what triggers your symptoms and understand how to control and manage some symptoms when they occur. You will learn which message from your bladder you need to listen to and which message you can ignore. Bladder training takes commitment and patience, as it will take time to undo the habit that may have developed over many months or years and replace them with good habits. Although many patients see some improvement within a couple of weeks, it can take longer for you to reach a stage that you're completely happy with. Bladder training is a long-term solution that need to be maintained. Many of the changes you make will need to continue for life, and that's why we refer to them as a lifestyle change. So who need to retrain their bladder? You might be teaching your bladder some bad habits that can gradually result in incontinence or frequent bathroom breaks. For example, if you routinely urinate before your bladder is full, it learns to signal the need to go when less volume is present. That can set up a vicious cycle as you respond to the new urge and teach your bladder to run when less and less urine is present. Luckily, all bladders can learn new tricks. As with any training, you want to know where you are before you start, so you have something to measure against. With the bladder training, this will most likely take the form of a bladder diary. This is how an example of bladder diary looks like. So you need to do a 3 days recording. Is the continuous 3 days. Normally, we advise patients to do a consecutive 3 days. Need to record down their urine pass. Means each time need to measure the urine volume. Also need to record down their fluid intake. Means each time to drink any fluid, include coffee, tea, water, any type of fluid, they need to measure the volume and record down. When patient doing this 3 days recording, we ask patient try to follow their normal life habit because we want to know normally how do they drink water, normally what type of fluid you drink, and how they pass urine. So from this 3 days recording, we will know their total fluid intake, normally what type of fluid they drink, and their drinking habit, and their fluid distribution, and their urine volume each time. So roughly we know their bladder capacity, means how much your bladder can hold the urine. So the night, we also can know the nocturnal, means nighttime, how many times they wake up to pee, whether they have any leakage. So if you feel this bladder diary form a bit complicated, at home you can just take a empty A4 size paper to record down date and time, and each time what time you pass urine, and then you just chart down the volume, and when you drink water, you also just chart down the volume. Bladder training techniques include lifestyle modification, scheduled bathroom visit, delay urination, pelvic floor muscle exercise, habit retraining. Lifestyle modification, ensure you are drinking enough fluid throughout the day. Avoid drinks that can irritate your bladder. Avoid drinking within 2 hours of going to bed to reduce the risk of your needing to get up for the toilet during the night. Do not drink all your fluid at once. Space your fluid intake out during the day. If you drink a lot at once, you can expect the need to go to the toilet urgently, not too long afterwards. Fluid balance refers to controlling the amount of fluid in your body and keep it within a healthy range. Drinking too much and too quickly can overwhelm your kidney. It can make your urinate more frequent. Here's the too much fluid here. I'm not referring the overhydrating amount of fluid. I'm simply referring to fluid exceed your need. A lot of people reduce the amount of fluid they are drinking as they believe it will improve the leaking and also will improve the frequency. So a lot of people before leave the house, they drink less water because they scared go outside, they need to find the toilet. But in fact, if your urine is too concentrated, it will irritate your bladder and make it want to empty more often. So too little fluid here is not referring to dehydrating amount of fluid as well. So how much fluid is enough? Check with your doctor to see if you have any fluid restriction. If you don't have, your fluid volume should be at least your body weight, kilogram times 30 ml per kilogram. Example, if your body weight is 60 kilogram times 30 ml per kilogram, means the total fluid per day you need is 1,800, 1.8 liter for the whole day. So this fluid include water, other drinks like coffee, tea, fruits, vegetable. Also, do take note the activity level and the environment temperature into consideration. If you are doing exercise, you sweat a lot, or if you are working in the outdoor environment, you also sweat a lot. So you can drink more fluid. You also can check the color of urine to see if you are drinking enough fluid. So normally, if you drink enough, your urine will be yellow or light yellow. So if you notice your urine is a dark yellow or tea color, means you are not drinking enough water. You need to drink a bit more. Also, a lot of people drinking too much water until their urine will be white color, like water color. Actually, it's not necessary to drink so much. Bladder irritants. What is bladder irritant? Bladder irritant is any food, drink, or medication that irritates your bladder. Irritants can cause you to experience a frequent but small amounts of urination, urgency to urinate, the feeling of needing to urinate which cannot be delayed, urine leakage if there is a sudden urge to pee but not enough time for you to reach to toilet. The common irritants include caffeinated drinks, example, coffee, tea, Coca-Cola, spicy food, citrus juice and fruits, dairy products, tomato-based products, carbonated drinks, and alcohol. So I've got some patients from the diary, we can see they are whole day drinking coffee or tea. They only just drink less water because they see from they are young, they starting drinking a lot of coffee, tea. And some patients whole day just drink soft drinks. A lot of elderly don't like to drink water because they feel the water no taste. Actually, you can add some lemon or cucumber into water, makes the water a bit tasty. So try to cut down all these caffeinated drink and drink more water. How to identify your bladder irritants? You can try to experiment and see what diet works best for you. You can stop consuming food and drinks that you suspect will be bladder irritants for 2 weeks. Observe to see if there are any improvements in your symptoms. Restart the suspected bladder irritants and observe for any reappearance of symptoms over the next 2 to 3 days. You may not have to stop consuming your favorite foods and drinks. You can reduce the amount of food and drinks you consume. Schedule bathroom visit. Determine how often you are going to the bathroom based on your bladder diary. Then add about 15 minutes to that time. For example, if you are going to the bathroom every hour, schedule bathroom visits at every 1 hour, 15 minutes. Use the bathroom at each scheduled visit, regardless of whether you actually feel the urge to go. Gradually increase the amount of time between the bathroom breaks. Delay urination. When you feel the urge to urinate, hold it for another 5 minutes. Then gradually increase the amount of time by 10 minutes until you can last for at least 3 to 4 hours without having to go to the toilet. If you're feeling a strong need to go, you can try distraction yourself by counting backwards from 100 to 1 or practicing relaxation techniques such as deep breathing or pelvic floor muscle contraction or apply peanut squeeze. When you just cannot hold it anymore, use the bathroom, but go again at your next scheduled void time to stay on your bladder retraining program. Pelvic floor muscle exercise, also known Kegel exercise. It can strengthen the muscle you use to start and stop the flow of urine. Research finds that combining pelvic floor exercise with other bladder training technique is very effective for treating incontinence in women. So this pelvic floor muscle exercise is quite easy to do. You can do in any position, means you can do when you are sitting down, lying down, or standing up. Try to relax your upper body, breathe in, and when you breathe up, try to think about drawing up your pelvic floor as though you are trying to stop the or urine midstream, lift and squeeze your pelvic floor gently without holding your breath. You can try it. Aim to hold for 3 seconds initially, build up to 10 seconds over time. Rest your pelvic floor for the same amount of time as you hold the lift before repeating. Aim for 3 to 5 holds in 1 set. Build up to 10 over time. Repeat 3 sets per day. This kind of exercise is also a long-term commitment. You need to do every day, and you need to do at least 3 to 4 months. You will see got any improvement or not. If you see any improvement, try to continue. Because it's like all our body muscle. If you stop exercising, your muscle will become weak again. Pro-urination habit, you may have pro-urination habit such as before goes out, before you hop into public transport, you tend to go to toilet even though your bladder never calls you. Pass urine whenever there is a bit of urine, as our parents our grandparents told us it's no good. Hold back your urination since we are young. But actually, our common bladder capacity is around 300 to 500 ml. The first sensation to urinate is felt when your bladder is around 40% full, means around 150 ml to 200 ml. You feel a strong urge to urinate when your bladder is around 90% full. Capacity means it's around 360 ml to 500 ml. The bladder should hold about 400 to 600 ml of urine, but most people will get the desire to empty their bladder when it contains around 300 ml. The number of visits to the toilet each day should be between 4 to 8 and up to once at night. However, this really depends on the amount of fluid that you drink. Habit retraining. Your bladder can learn and adapt based on your urination habits. If you're urinating frequently, it can also cause you to feel a strong urge to urinate, but only produce a small volume of urine. Good bladder habits includes, remember, our bladder can be trained, and we have good bladder capacity is 300 ml to 500 ml. The function of bladder is to store urine. So try to only go to the toilet when your bladder is full and when you feel a strong urge to go. Do not go to the toilet when you feel the need to pass urine, just in case, and this may result in your bladder developing a smaller capacity, unless you are going on a long trip or just before bed. Take your time when emptying your bladder so that it empties completely. And being in a rush may lead to incomplete emptying. Sit properly during urination. Do not force or push too hard to pass urine. Tips to bring home and practice. Remember, bladder can be trained. Look at your lifestyle and urination habits. If you are bothered by it, change it accordingly. Always seek professional advice if you are unsure. Thank you. Thank you for your time. I'll be hand over to next speaker.
That's right. Let's give it up for Yuqian with her very enlightening presentation. And just do a sound check. Can all of you all hear me loud and clear? If yes, give me a thumbs up. Awesome. All right, next up, I'm going to introduce our next speaker. We have Miss Aug2024, who's a senior physiotherapist from Novena Specialist Center. And today she's going to share with all of you a very, very important topic, core muscles. What are they? And some exercises to keep them healthy. Over to you, Wan-Hui.
Hello, everyone. Thanks for joining us on this Saturday morning, and thanks for the invite to speak. I'm very passionate about the pelvic floor and the core, so I'm going to try to keep to time, okay? So yes, I'll be talking about what the core is, what it does, and how to keep the core healthy. But before we move on, right, pelvic health physiotherapy, I wonder how many of us have actually heard of such a brand of physiotherapy, and I just want to let you know how we help. So basically, pelvic health physios help people who have difficulty holding it in. So you will find whatever I say, some of it actually mirrors what Sister has shared with us just now. So anyone who has difficulty with bladder or bowel control, pelvic health physios help with that, okay? And any difficulty with letting it out. So, you know, in the Continence Society, we talk about incontinence, but I think also a big portion of everyone out there might be experiencing difficulty. Some people have difficulty letting out urine, okay? So most of us might find that surprising, but it is true. There might be also difficulty releasing motion, so constipation, piles, might be an issue as well. So I hope that with my talk today on the core, we'll be able to help with both of these things, yeah? And I think last but not least, I wonder if this is very sensitive, but I hope all of us here are adults, right? So then difficulty with sexual activity and function. So some people actually do struggle with pain or discomfort or erectile function issues. That is also something that pelvic health physios like myself treat. And like, okay, so pelvic health physio are some very strange functions. So what muscles do they work with? The core, which is why I'm talking about the core today, okay? So what is the core? I think most of us think maybe the abdomen, you know, maybe the abs. Or maybe the back. But the core is actually a very, very big group of muscles. Okay, so I must say there is not actually standard definition of what the core is, okay? But let me explain first what it does, yeah? So the core is important for stability. Anyone who needs to move, yeah, your core needs to first be stable. Otherwise, your arms and legs cannot move properly. If you've ever noticed that, hey, if I stand on one leg, I'm not very stable, likely is one of the muscles within the core or a couple of muscles in the core not functioning as they should, which is affecting your ability to balance. And I think in this day and age where technology is something we use a lot of, screen time is something that unintentionally is going up, whether we want to, we like it or not. You know, posture, you know, you might find that, hey, when I'm sitting, not sure why, how come, you know, slouching, my chin just gets drawn forward. That is a signal to you that some of the muscles in the core perhaps not as strong, the other muscles in the core perhaps a bit tight. So it's unknowingly pulling your body into a certain position that is perhaps not ideal, yeah? Now, the other thing about the core, I think we stress a lot about strength and stability in the core. What is perhaps not as well known as flexibility in the core. Now, when the core is flexible, it can absorb shock. Then you're like, oh, why need to absorb shock? You know, when you do things like, you know, you run for your bus, right? Then there is some pounding involved. The flexibility within your core allows shock absorption, meaning to say that shock is not going to go into your back and give you back pain, right? That shock is not going to go straight into your pelvic floor and cause urine to leak. You know, when you shout, right, because someone makes you angry, or in my case, I've got 2 children, 7 and 9. So sometimes speaking in a very civilized manner doesn't get their attention. So sometimes I shout, I speak a bit louder. That requires shock absorption as well, okay? So breathing, transfer of forces. So any movement really will require your core to work well, yeah? Now, the other thing is power. So then, you know, if you need to walk a bit faster, you need to lift something, your core is what you are actually relying on. And last but not least, it actually becomes a container for your organs, right? Together with the bones. If you think about it, if you touch your abdomen now, you know, do you feel much bone? Actually, no. So a big portion of this is your core holding your organs in. So if your core is too tight, can you imagine the circulation to your organs not great? Okay, so then that is in essence what the core is. So where is the core? Now, if you take a look at anything that is kind of pinkish in color on the screen, right? So here on the front, in the right, all the way down to the bone in the pelvis at the front, we call the pubic symphysis. On the back, you see your buttocks all the way down to the legs. This is the outer core, yeah? So on the inside, if you take a look at this simplistic cartoon drawing, you see how there is some pinkish muscle in the spine. So this is actually a portion of your core as well. So your back is included in your core. And I'm not sure if this comes as a surprise to some of us, but the diaphragm, the muscle we use to breathe, is part of the core. Again, there is a deeper portion of the abdomen, is part of the core, and we heard sister talk about this muscle just now, the pelvic floor. This is also part of the core. And then it leaves some of us wondering, is there a portion of the body that is not the core? So I think safe to say the things in the arms and further down in the foot, that one not considered a core. But if you are thinking like, hey, the core is like connected everywhere, that thinking is correct. Okay, so the core really is there to connect the top to the bottom, so it's a very large portion of the body. Yeah, and so I'm going to give some spotlight time to this my favorite muscle in the body, the pelvic floor. Yeah, so both males and females have a pelvic floor, as you can see here. So this is an ultrasound scan that I do a lot in clinic. So this particular scan is of a female, yeah. So this kind of a black triangle is the bladder, the urine in the bladder. There's the urinary tract. So you can have a look at this lift. Here is what the pelvic floor does. So lift and relax, lift and relax. Okay, so that's what the pelvic floor is doing in every one of us. Even when we are breathing, there is a very small movement like that happening in your body like now. Okay, so what can go wrong in the core? So I think I've already alluded to this just now. It can be too tight. So what is too tight, right? So usually we say too tight. What are you thinking in your mind? Too tight actually just means to say not elastic enough. So this is too tight, okay? So it's just, you can see the abdomen here is too stretched. So elasticity wise, not great. So a lot of times you might find like if you were to touch an abdomen that looks like that, it can feel very hard. This is also too tight, yeah? I don't know whether you can tell, but this is an AI drawing, okay? But so these are different spectrums, but they're both too tight. Then there is also too weak. So if your muscle is weak, a lot of us think like, oh, it must be really soft. But anything that is too tight or too loose is going to be not good in terms of generating force. So if you cannot generate enough force, then potentially it's weak lah. It can also be too active. So you know, like that picture you saw just now, you know, the muscle man, it's just too active. Or then again, not active enough. So there might be no issue in terms of is it elastic enough or not. It can be elastic enough, but you know, if you are doing certain activities and there is a portion of your core that you're not used to using. So say for example, common example, females, right? Once we go through pregnancy, a lot of stretching happens in terms of like the abdomen. So sometimes moms don't get an opportunity to really get back into fitness. So then we might be dealing with like, hey, you know, there's not enough activity in the abdominal wall because of this stretch that wasn't given enough attention, yeah? So what can go wrong, how it might feel to you is that, oh, you know, why is it my posture is always kind of like, I can't seem to hold myself up at all, balance is not good, I keep having pain and stiffness, doesn't matter what I do. Then comes, see the pelvic floor, right? So whatever sister talked about just now, you know, difficulty in bladder control, your bladder is calling you, you know, when like, how come other people can sit through the movie, but I'm the one getting up? And then difficulty with bowel function and sexual function, it can affect the way you breathe. So if your core is too tight, you might find that your breathing is very shallow. So you might not feel anything like uncomfortable if you're not having to exercise. But if you're asked to do deep breathing by some people, so later I'm going to ask you to breathe, okay? Then you might find like, wow, how come her ribs can move like that? How come my ribs cannot move like that? You know, then you might find like, okay, perhaps some tension going on. And it actually affects how the body looks, right? So you already saw the two abdomens that I've shown you, yeah? So then, you know, you can look less aesthetically pleasing as you might want yourself to be, yeah? So how to keep the core healthy is what I'm supposed to talk about, right? So basically, exercising to improve awareness and control. So I'm not necessarily talking about like getting abs. I'm talking about knowing when to relax when you are supposed to, okay? And then knowing when to turn these muscles on when you should. So we are going to try, okay? A bit challenging for online platform, but yeah, we'll try. Okay, so hang on now. I'm just going to shift these things around so I can actually see the full screen. Okay, so every one of you, wherever you are, if there's enough privacy, you can try what I'm showing you on screen, okay? So put your hands kind of at the last portion of your ribs. So that should be where your waist is, the narrowest portion of you, huh? Okay, so just have a feel like, yeah, are there ribs there? So later on when you try this, when you breathe out, think of using the muscles in your body to narrow the ribs. Okay, when you breathe in, think of widening around. So I'm going to play this video so you can see what I mean. That's me breathing in. This is me breathing out. Okay. Okay, so everyone, you just try, see whether you can create this movement or not. So just play this again. So when you breathe in, you should feel, my hands are moving out. Then as you breathe out, yeah, your hands are moving back in. So how many of y'all find this challenging? Okay, in terms of the abdomen, you take a look at the video again. The abdomen is not necessarily becoming rounder. Okay, so those of us who are not very used to turning on your abdominal muscles, you might find my ribs are not quite moving. The tummy is the one becoming rounder, correct or not? Honestly speaking, there is no right or wrong, right? But if we are thinking of turning on a specific part of your core, so this kind of breathing requires what I call the oblique muscle movement. And the reason why we want to breathe like that is you are allowing the diaphragm, remember the part of the core that you use to breathe, right? To move as much as possible, yeah? So then your pelvic floor actually can go through the movement as well. So there's better blood supply and everything, Okay, so you take a look again, okay? So the movement is here, it's not up in the chest, although there is some, and it's not down here in the belly, yeah? So this will take some practice, okay? Okay, so then what we also want to do is to make the breath out slower. So a lot of us breathe very fast, like this, okay? So slow the breath out, so you go, then you breathe in. If you can make the breath out twice as long as the breath in, okay, that will be best case scenario. But if you can't, please don't worry about it. So with practice, you will find that this is easier. Now, this is not how you will breathe all the time because it's very tiring, okay? So you basically, how you can use this, how to fit this in my life, you know, I'm really so busy. She's still asking me to do the impossible, do even more exercise, right? Okay, so you try to fit 5 of such breaths in through the day. So if you're waiting for the lift, if you are queuing, you don't actually have to do this when you're outside. Okay, so you can actually just kind of have your arms by your side, or you can actually cross your arms. So I often will do, you can do the exercise like that. So just go. So then like nobody knows what you're doing really. So none of the, okay, most of the time when I teach exercises, you don't have to like have a gym membership to do stuff. You can literally like do it anytime, anywhere, yeah? Or you can use this to like take a break, you know, between work, because most of us stay very still when we're working or when you're feeling stressed, to help to release some of that tension that you have unintentionally stored in your body after workouts or a long period of not moving and before you go to bed, just to relax, yeah? Okay, now again, spotlight on the pelvic floor, my favorite muscle, right? Okay, so your pelvic floor actually works on controlling the bladder and bowel, so right, keeping it in, okay? Then here on the left is for passing urine and stool, so you need enough relaxation for you to be able to let it go as well, yeah? So, you know what sister shared with us just now, you feel the bladder more often. So surprise, surprise, if your pelvic floor is too tight, it can make you feel like you need to go to the toilet even though you don't feel like it. Okay, and if you've ever felt like, I'm done passing urine already, I still feel like there is, you know, urine in there. Actually, that could be your pelvic floor kind of switching on when it's not supposed to, giving you the feeling you need to pee also, yeah? Okay, then any issues with sexual function, because this is what the pelvic floor does, yeah? Erections in men is kind of in part because of these muscles. Orgasms in both males and females will be the role for this pelvic floor, yeah? And then support for pain-free movement. So movement is a lot of what we are talking about now. Okay, so now, sister actually also talked about this just now, so we're just going to reiterate. So everyone, if you are seated, you try and sit in a relaxed manner. Breathe normally, just make sure your tummy, your buttocks, your thighs are relaxed, yeah? Okay, now think of tightening around the back passage, so the anus, like as if you are trying not to pass wind, okay? A lot of people tell me, can you not want to pass wind when you want to? Yes, if you want to be socially responsible, you must be able to hold it in when you're in a very crowded environment, okay? So you tighten around the anus and then you let go, right? Without changing your breathing. Okay, now can you think of tightening around a slightly different set of muscles around the front? like as if you're trying not to pass urine, okay? If you can't separate the two, it's perfectly fine. More likely you can separate if you're male, less likely you can separate these two if you're female, just because of the way things are wired, yeah? So then a pelvic floor movement contraction is actually the tightening of both the front and back without changing the way you breathe. So this portion is very, very important, okay? And please don't pull in the tummy if that's possible at all, because if you're using pelvic floor exercise for bladder training, pulling the tummy in is going to press on the bladder, which will make you feel even more like you need to pee, yeah? Okay, so again, because this is online, I'm going to show you some videos, yeah? So movement around the middle is correct, pelvic floor movement. Movement around the buttock at the side means you're just clamping your bum. Will give you a perkier bum, but not better bladder or bowel control, okay? So have a look. This is what pelvic floor movement looks like. So you can actually put a hand on your clothing on the outside to see if you can feel the right movement. Now, this is the wrong movement. This is just movement of the buttocks, okay? So we're going to have a look again. This is the right pelvic floor movement. So you can actually put your hand kind of close to where the anus is. When you do the pelvic floor movement, you should feel a lift. When you relax, it should come back down. If you have any doubts on any of the exercises that we're going through, please look for someone to help to check, okay? None of the exercise supposed to cause pain, yeah? So now when do we do the pelvic floor exercise? So you can try, I mean, I don't have the opportunity to assess everyone. If I could, I would. So these are basically just general advice. If you actually have a problem already, best you get someone to take a look to see whether or not you can even do this. Okay, but you have a look and see whether or not you can do 3 sets of 10 a day. So again, you have to breathe normally. So you should be able to engage someone in a conversation when you're doing this without anyone knowing that you're doing anything at all. And you should relax fully in between. So you can do this when you're waiting for the lift, when you're queuing, because as Singaporeans, we do a lot of queuing, right? And then again, this is what Sister mentioned, right? You use these muscles to help you to get to the toilet in time. Or if you have been advised by a healthcare professional that yes, bladder training is appropriate thing for you to do, then you can see whether turning on these muscles, holding for a bit, can help to relax the bladder, reduce the feeling that you need to go to the toilet, yeah? So the other times that you should turn on these muscles will be if you are exercising, you're exerting, right? When you jump, when you lift weights, when you're coughing and sneezing, turn these muscles on as well, just to offer a bit more support. Yeah, and then basically using these muscles during sexual activity is going to give you better function lah. Okay, okay, so now we talked about how to turn on, how to turn off. Then one of my favorite kind of patients to treat is anyone who needs to let it go in the toilet, right? So relaxing the pelvic floor completely. So making sure that you're not tightening around the anus when you're trying to pee or poo is very important. So if you can't lean forward, right? Because going in this kind of position gives you a headache, gives you back pain. It's okay, but what I'm trying to show here with these red lines, right, is that you should be pushing your pelvis forward and letting the belly out, okay? This position helps you to achieve the best relaxation. I'm not the tallest person, I'm only 161, okay? So this is me in most toilets. So if you don't like this feeling because it kind of makes you feel like you're falling forward, you can actually go on tiptoes just a little bit, but making sure that everything in the bum is totally relaxed, okay? So this is what I would consider better pooping positions. But again, if you're having issues and you find, no, this position doesn't seem to work for me, then see someone who can actually check for you which positions might be better for you, yeah? Okay, then moving on, then we've got movement. So remember the core spans the whole body. So just don't be surprised that, how come this kind of movement can work my core? So you're going back, stretching up, and then you are leaning away. So now when you are doing this, what you are going to do is basically stay in this position and breathe into your ribs 3 times. So remember the breathing we did just now, right? Into the ribs, yeah? So what you are going to do here is, I've only wrote down 2 times each side, but if you're going to try this as an exercise, you're just going to keep going with the different things that I'm going to show you, like a little routine. Then yeah, you will basically just go through it like almost like a 15-minute different kinds of stretches. Then you just keep repeating, okay? So then that becomes exercise for you, yeah? Then the next one is basically onto the inner thigh, which is very linked into your pelvic floor, therefore considered part of the core, yeah? So just moving side to side and then relaxing the belly. So just breathing and moving, okay? Then this is a good stretch for the muscles in the back and into your hamstrings for those of you who are tight. So you're going to lean forward and then move to one side. So while you're here, just make sure you're sticking your ribs out on this side. Then just making sure you're breathing into the ribs, okay? So as you are breathing, usually what happens is you're going to feel like, wow, I become even tighter. That's normal, okay? So that's what you're feeling. The muscles that connect your ribs all the way down to your pelvis and into your legs, that is essentially what the core is, yeah? So again, I've only written here 2 times each side, twice a day. This is kind of more to use as stretches. If you find your life is very like sedentary, you're just seated. But if you're going to use this as exercise, then you're going to use it as a circuit, okay? Then we've got the hamstring stretch. You'll be surprised a lot of the people I see cannot get into the good pooping position and are very stiff because the hamstring is very stiff, yeah? So here the thing to point out is just that the back should be flat. A lot of people can actually touch their toes just by bending the upper back, okay? So the back has to be flat. You're pushing the pelvis forwards, okay? And you don't have to go very far to feel the stretch. And please don't cause any pain with any of the exercises, okay? Then we've got, oops, I'm sorry, I'm almost done. We've got this exercise, which is bridging. And if you search pelvic floor exercise on the internet, more often than not, this is what you're going to find. But I hope now that you've heard this public forum, you know this is not pelvic floor exercise, but it is exercising for the core. It is, okay? So you're just going to lift your bum up and breathe in through the ribs 3 times before you put your bottom back down. Now, this is a movement I use a lot in clinic because for most people, this relaxes your pelvic floor. Interesting. It actually turns off the muscles in the hip that are very tight, in the pelvis that are tight, and it's actually working the powerhouse of the core, you know, your glutes, yeah? So again, you know, this prescription is more for as a stretch. Remember, if you wanted to do this as an exercise, you're just going to repeat, okay? Yes, so basically with the stretching and movement, you want to do it kind of with like taking a break when you're stressed. Or when you're stressed, you don't have to do the whole set. Just pick and choose what is comfortable and convenient for that time. After workouts or long periods of not working, you really should be moving around at the start and at the end of the day. And now, if you're wondering, wow, the exercise you show very easy, huh? Really can exercise, man? You are right, because I don't have the opportunity to check everyone. I'm not quite sure if giving you anything that is harder can potentially be harmful, which is why the exercises I've given are basically the safer stuff to do. But you are right, it's not enough to strengthen the core per se. So you do have to add this other component, which is movement, okay? So what I've written here is something along the lines of brisk walking, but if you are actually used to jogging and you're fine with it, doesn't cause you pain, you definitely can do that. And then adding like a strength component that is also cardiovascular in nature. So stair climbing, climb up, take the stairs down. Or if you know how to swim, you have access to a pool, swimming, do something similar. And the timing would be something like, oh, maybe 30 minutes of this, 20 minutes of that. And then you add on to about 50 minutes. And if you can try and achieve 3 times a week, that would be good conditioning for the core. It will be good massage for your intestines. So yeah, if you are doing this seldom, you know, you will get constipation. And this is quite similar to what Sister said just now. If your urine looks like water, it has no color, likely you're overhydrated. You want it to look something like a very pale straw color. And also what Sister said was space out your drinks. Don't drink everything all at once. So that's why, you know, kind of always have your bottle with you. Then yeah, so limit irritating drinks, yeah. Not everything here is irritating to everyone, so most of us know, yeah. So for me, it can be things like coffee. For some people, it can be things like barley water in the evening, you know, just drive me nuts because I have to wake up many times at night. Yeah, so just basically know yourself, huh? And again, mirroring what she said, right? Only go to the toilet when you need to. Singapore, I think, is progressed to a point where most of the places has nice clean toilets, huh? So just a summary on how to keep your core healthy, right? So work on your breathing exercises, pelvic floor exercises. You can do these anytime, anywhere. And just highlighting the need to actually move often, okay? And then drinking enough water. Yeah. So I'm sorry I've taken more time than I should, but yes, I am done. Hang on now, I'm just gonna, actually, I'm gonna stop share now.
All right, and that was Miss Ip Wan Hui from CT Osteopathy and Physiotherapy, and she's a very experienced pelvic health physiotherapist. I hope all of you are enjoying her tips for those pelvic exercises. Do you think that these are exercises that you can try from home? I definitely am going to try in the office because all of us in office are leading a sedentary lifestyle. All right. So once again, if you're enjoying the presentation, okay, please don't feel shy to type your questions into the chat, and our speakers will answer them during the Q&A session later. Now, for those of you who may want to ask questions in confidence and don't dare to type in the chat box, it's okay also. You can actually float the questions to me. So you can see my name on the chat box, marked Spring Publishing, right? You can send the questions to me and I'll raise them on your behalf during the Q&A. All right, before we go on to the next speaker, I would like to share a few kind words from our sponsor. So just give me a minute to share the video.
Before I used to use ordinary sanitary pad, the leak is quite bad and it causes odor. It's really very embarrassing. I started using Tanner Pro Skin pants. It is so comfortable. It absorbs the urine very well.
Next up, it is my absolute pleasure to introduce our next speaker. We will have Dr. Rana Aruz, who's the Associate Consultant for Geriatric Medicine, Alexandra Hospital, who'll be sharing with you Nocturia, a thief of sleep. So for those of you who don't want to have your sleep disrupted by Nocturia, take lots of notes. All right, Dr. Rana, over to you.
Thank you very much for those kind words of introduction. Hello, everyone. My name is Dr. Rana, and I'm a consultant of Jerry at AH, and I have a special interest in incontinence in older adult. So thank you very much for having me here today. So nocturia is basically is when someone wakes up from sleep to pass urine. So the urgency that you feel to pass urine at night is what wakes you up. And that's when we call it nocturia. And of course, it's a silent thief of night that most of us may not talk about out of fear of embarrassment or stigma, but it is something that has a massive impact on our lives when we do experience this. So some of the questions that we experience, some of the things we experience is that you end up waking up so many times in the night that you may at times feel that you're actually spending more time in the bathroom rather than in your own bed. Or sometimes you keep waking up over and over again that going back to sleep actually is quite a challenge after that. Then you wonder, is this actually normal? Is this something because of aging, so I just have to bear with it and go on? Or is there something that can be done? So going back again to the definition of what exactly is nocturia, it's that when technically it means that you wake up more than once in the night. But generally, when we consider it a threshold for acting, especially in older adults, is when it is disturbing your sleep by waking up 2 or more times in the night. So technically, although nocturia this means waking up once or more in the night, we do tend to intervene if, let's say, it is happening at least 2 times. Because as we know, the reality is that as we age, there are some changes that do happen in our body which can increase your chances of waking up in the night to pass urine. So which is why we have that threshold as such. Okay, but definitely it's not something that we should be bearing. If it's still bothering you, please bring it up with your healthcare professional. The other important thing that I'd like to state is that nocturia ultimately is only a symptom of a condition. That means it's something that you experience because there is something else underlying going on in your body. So it's important to not stop it as, oh, I'm waking up to pass urine, it's a problem, but it's about finding out what is causing. And most often as we grow older, it's not one single cause, but tends to be multiple causes that we are going to talk about in this talk today. So it's not a disease, but instead it is something that should prompt your doctor to find out the causes. But it's actually more common than we think. If you look at the statistics, about 50% of all adults over the age of 65 do tend to get up at least once in the night to pass urine. And out of them, 24% will generally tend to have 2 or more episodes of waking up in the night to pass urine. We also spoke about aging. Although we don't think of it as a normal part of aging, there are still things that happen in our body with aging, unfortunately. For example, when we grow older, our bladder is less elastic, okay? So, which means that it doesn't stretch as much as when we were younger. So because of that, how much urine our bladder can actually hold, as shown here, can actually reduce as we grow older. In men, we do know that there is this organ called prostate. It surrounds, just below the bladder, it surrounds the tube, the urethra, the tube that passes the urine, from the bladder to out. So that's the urethra, the urine tube. So surrounding it over here is this structure called the prostate. So when men grow older, this is something that's present in men. And when men grow older, the prostate does tend to grow bigger. So as you can imagine, it's surrounding the urine tube. So it can actually press against the urine tube and so affect how well the urine passes out from the bladder. So which is why when we grow older, men may experience slowness in the urine flow as well. It can sometimes tend to stop the flow as well, among other issues. Most often, you end up feeling the urge to pass urine very frequently, both in the daytime as well as the nighttime. Okay, it's just that when nighttime passing urine tends to be more of a bother. Sometimes we do have patients who complain of nocturia, waking up to pee, and then when we explore further, actually it's there throughout the day. And then when we work up further, we tend to uncover causes, including prostate enlargement. If you look at the picture here, I think this gives a better idea. So we say that when you are age of 20 to 25 men, the prostate tends to be as the size of a walnut. Then 35 to 40, it can become usually the size of a golf ball. Then 50 to 60 can become the size of the lemon, quite bigger. Then after that, 70 to 80, like cricket ball, it can become. Okay, it doesn't happen in everybody, but it's most likely to happen as you grow. It's quite common as you grow older. And in some, it can cause more symptoms or problems with urine than others who may have the enlargement. So that is for men. But women also have problems, and actually women experience, because of hormonal changes, quite a bit of urine-related issues. So as you can see over here, our estrogen levels are very important. As we grow older, as you can see, beyond 40, when menopause starts hitting us, then our estrogen level in the body starts decreasing. So as you can see, by the time they're 70 already, the estrogen level has significantly dropped. So what does this mean for us women? What it means is that with the decrease in estrogen, the strength of the muscles that support the bladder, the womb, and so on, can be affected actually. because estrogen levels are important on maintaining, the elasticity, the strength of this muscle, what we call the pelvic floor that my colleagues have previously spoken today about. So when estrogen levels decrease, there can be a bit of laxity in the pelvic floor muscles that can occur as a result. My colleagues also spoke about various things that we should be doing, such as pelvic floor exercises to try to strengthen. It's a muscle after all. But biologically, this declining estrogen hormone level is one big culprit for it. And when the support structure for, the urine system is actually affected, then that can increase the risk of incontinence as well as other urine troubles, including, the need to pee multiple times, including at night. So what is the deal? So why are we so bothered? Why is nocturia such a big issue, that is waking up in the night to pee? So as many of us who may have experienced this, it can result in disturbed sleep, and some may have trouble actually going back to sleep after urinating. And this can be as high as a third of people experiencing this issue of nocturia. And when you don't have good sleep, it's been shown conclusively that it's not good for your health. It actually does increase your risk of death as well. Okay, so it can also affect control of other medical issues as well you may have. It's a source of stress for the body. And not only does it affect your sleep, it can affect the sleep of your partner or caregiver as well. And in elderly, when you wake up to pass urine in the night, it increases your risk of falls because you're still a bit groggy and then, you're trying to pee and then multiple times, or your walking may not already be so great as before. And then all this increases your risk of falls and breaking bones, fractures. But the good news is, despite all that I've been telling and trying to scare everyone, it's actually potentially treatable. And what's most important is to seek help. Don't suffer in silence. Get help early. There's many things we can do. And the secret is to actually working it out early, finding out the potential causes for this issue. So like I said, there's things that can be done. There's behavior modifications that can be done, which includes adjusting your fluid habits, exercise, including pelvic floor muscle exercises. There's also medications as well, depending on the condition that's causing the nocturia. Okay, and if we can manage this well, we can, benefit from more productivity. We can think better, lower our medical risks, fewer slips and falls as well. So going back, why? So I keep talking about how important is it to find out why is it happening. Okay, so generally when we think of passing urine, we can roughly think, is it because my bladder, which holds the urine, can't hold enough urine as it's supposed to? Or is it an issue that our kidneys, which makes the urine, so the kidneys make the urine, the bladder stores it, and then we pass it out, right? Or is it an issue where the kidneys, which produces the urine, is making too much urine either in the day and the night? Or in some cases, there's situations, medical condition, where you make more urine in the night particularly, and that's why you're waking up to pee. Okay, so it's very important to find this out, that not only, if you're waking up to pee, how many times in the night, how much urine you are passing, is it only in the night, is it in the day? These are all questions that your doctor is going to ask if you have this issue. Sometimes though, it can be not really related to the urine production and instead due to other external things. For example, if I'm someone who's a light sleeper to begin with and the lightest, disturbances wakes me up, and then I wake up and I say, oh, since I'm up, might as well pass urine, So then that's actually technically not nocturia, but that's something we try to tease out from our encounter with the patients. Or sometimes you may even have a sleep disorder, a medical condition that affects your sleep as well and results in this. But beyond this, there's also multiple other reasons. So I'm trying not to confuse you, but instead try to make us all appreciate that it's not a simple thing, waking up to pee, and that there's so many things that needs to be, looked into. So one thing that we do look into is, number one, if you look here at the sleep, is there something that suggests a sleep disorder? So questions we ask our patients is, Do you have problems sleeping aside from needing to get up to urinate? That means do you have issues with sleep itself? When you wake up in the morning, do you actually wake up feeling refreshed? In the daytime, do you have issues with staying awake and you're falling asleep suddenly? Or at night, has your partner or a loved one told you that you actually snore a lot? That sometimes you suddenly stop breathing in between as well, gasp? Because these things may suggest issues like a primary, that is an issue with the sleep itself. It may suggest something we call obstructive sleep apnea, where it tends to happen more in larger body-sized people, but not necessarily always the case. But you notice that they suddenly stop breathing at night. Okay, so there's something very important to assess for as well. Okay, or you have other nerve-related problems where you have certain movements in the body as well as issue that affects your sleep due to it. And some of these, and these basically, if you manage those conditions, medications and other things, it can actually improve your urination in the night, the issue a lot. Okay. The other thing we always ask about, could it be like a heart-related issue? Okay, do you experience any breathlessness or chest pain when you're walking or when you're exercising? Then you need to see the doctor who will then evaluate your heart. Or if you already have known heart issue, do you have issues where you tend to store water in your body, which is why you may be already on certain medications for it? Does it need to be optimized any further? People with kidney issues as well. So often when there's a buildup of water in the, other than breathlessness, swelling in the leg, one of the ways is, you keep waking up to pee because all that water that's collecting in your body has to go somewhere, right? So you wake up to pee. Or is it an issue where your underlying medical problems like diabetes, high blood pressure, thyroid, these things are not controlled well? Because we know that in diabetes, right? If you don't control it well, what's happening is you're just going to keep peeing because your body is trying to get rid of all that extra sugar in your body. So the trick is not to limit your water, how much you're drinking, but instead it's actually managing your diabetes itself. So if the control improves, this should improve a lot. Okay, or certain nerve conditions, other than abnormal movements in your legs, is there anything, any shaking, tremors, shaking in your hands that may suggest an underlying nerve problem? Then that can also result in this issue. Medications that you may already be on can also cause you to wake up to pass urine because it may actually affect how much urine you're producing in the night or cause swelling in the leg. So when you're going to sleep at night, all the water goes back up and then you end up wanting to pee it out. Okay, or some medications can itself cause insomnia or affect sleep. Common culprits or thieves of this issue is things like furosemide, which basically encourages your body to pass out water, certain blood pressure medications, or simply drinking a lot of kopi O throughout the day. So what can we do? So we spoke about causes. Now, what can you do? Number one, it's very important to avoid things that can irritate the bladder and manage how much water you take throughout the day well. Okay, so if you look here, certain drinks irritate the bladder. Drinks like coffee, tea, even green tea has caffeine. Chinese teas have caffeine, tomatoes, alcohol, other fizzy drinks. So all this can have certain degrees of caffeine, can irritate the bladder as well. And we know that, we think that the fancy latte is very strong, but actually if you look at it right, it only has about 55 to 60 milligrams of caffeine. But if you look at that strong kopi O that you drink, and I have patients drinking 3 times a day, including the last one at 11 o'clock, of course you're going to wake up. It has about 250 milligrams of caffeine. You're going to wake up to pass urine in the night. So instead, try to opt for more bladder-friendly drinks. Plain water is the best at the end of the day. And like we spoke earlier, my speaker spoke about as well, it's important that you're drinking enough water. There's no magic number as to how much water you should drink. Ultimately, go by your urine. If your urine color is somewhere between 1 to 3, it means, that amount of water is good for you. Because if you don't drink enough water, that also irritates the bladder, and so you end up wanting to pass urine all the time. So that's one very important thing. The other thing is drink more water in the daytime and try to limit your water that you drink after bedtime, like after dinner, after 8 p.m., try not to drink any more water. If medicines you still have to take small sips of water to have it instead. Try not to keep visual reminders, water jug, then you're like, okay, it's just near me, let me keep drinking. So try not to, because I also have patients wake up to pee, okay, drink lots of water, go back again. Then of course you're going to wake up again very soon. So till about, usually we say 4 hours before bedtime, try to not drink much water at that point onwards. Okay, and then if you have swelling in the leg, it's important to manage it. First of all, what is causing it? Is it a medical condition, or is it certain medications that's causing it in the first place? Okay, then if let's say talking more about it, if you still do end up having this, and despite checking all this issue that I mentioned, tricks that you can do is take an afternoon nap, okay, with your legs bit elevated. So that way, whatever swelling that you have, you're trying to get rid of it in the day. So you're not waiting till the end of the day when your legs are so swollen that when you go to bed, you're surely going to pee because all the water is going to come back up. Okay. So, but if you're taking naps, try to take it no later than 3 p.m. and try not to sleep for longer than 90 minutes because otherwise you're going to have insomnia at night. Okay. So keeping the legs elevated, you're trying to do the work against gravity there. You can use compression stockings, okay, but just using like very thin stocking, without much pressing compression-ish power will not help. So it needs at least a certain amount of compression strength. Ultimately, exercise is very important as well. So I would say water-based activities would be the best. So there's actually like things like aqua gym and group exercises. Pool-based, these are gentle on joints, especially for older adults getting older, experiencing joint issues. Then walking, light jogging, all this can help. And important things to follow is sleep hygiene. Don't go to bed unless you're sleepy. So I have patients sometimes going to bed like 7 o'clock because they feel that, they don't have anything else to do. So if you go to bed at 7 o'clock and you're hoping to wake up at about 7 in the morning, that's, and most of that time is spent just lying in bed because you're not even sleepy. Then of course you're going to keep waking up, to pee as well. And that ultimately affects things. So don't go to bed unless you're sleepy, and don't stay in there unless you're sleeping. And try to sleep at the same time and maintain a consistent schedule as well. And 2 hours before bedtime, try not to look at screens. And going to the bathroom before the bed preemptively is actually a good idea. Avoid exercises. Exercises is good, but try to do it in the earlier part of the day. Otherwise, if you do it in the evening, it can affect your sleep. Sometimes people, sleeping aircon rooms, especially, the cold environment can make your body want to wake up to pass urine as well. So sleeping in a warm bed can help without aircon. But if you do wake up to pass urine in the night, try to keep the disruptions to a minimum so that at least you can fall back asleep easier. Keep the lights off. Keep some degree of light, otherwise it can increase your risk of falls. But so try to use like a night light of sorts. Try to keep the pathway to the washroom free of obstacles that can otherwise trip you. And another good idea is actually to keep something like a bedside commode or urinal so that you're walking less, so your sleep is less disrupted. Then my colleague already would have spoken about bladder retraining as well. Ultimately, it's good to stick to a schedule, and daytime go to pass urine only when you feel the urgency, not because, I'm going out, so let me use my toilet at home, which is clean, and avoid using toilet when I'm outside. Then for the next 6 hours when I'm out, I'll just keep holding. Okay, so try to avoid that kind of behavior, which, to be honest, most of us are quite guilty of doing. So try to follow your body. When it tells you that you need to pee, then you go and pee in the daytime. Okay, instead of actually, doing it as and when. But when you're doing a bladder retraining, then you have a schedule that you're trying to achieve, okay? And so that one, you stick to the schedule in the daytime. And then you slowly stretch the interval so that you don't have to keep going to the washroom. And better success is when you pair it up with pelvic floor muscle exercises. So in a nutshell, I would say that's a summary of my talk. Please feel free to ask questions at the Q&A session or drop some messages. Thank you.
Thank you so much. And that was Dr. Rana Aruz, consultant of geriatric medicine from Alexandra Hospital. Now, ladies and gentlemen, if you just joined us, be sure to jot down your questions. And if you have questions for doctors and our speakers, please feel free to raise them during the Q&A later. Next up, it gives me great pleasure to introduce our next speaker, who will be sharing with you actionable tips to avoid staining your underwear. And let me introduce Dr. Lin Jit Fong, who is the president for the Society for Continence Singapore. Dr. Lin, the stage is yours.
Thank you, Mark. I think you're very enthusiastic in introducing all of us so far.
Really enjoying this.
Before I give my talk, I just want to take this opportunity to thank all the members in the audience for staying on and joining us today, because the main aim of us having this public forum is to share information that we hope that you find that useful, that can help you improve the quality of your life. If you find it useful, please share with your friends and family as well, so that more people are educated and more aware of what they can do to prevent problems with incontinence and pelvic floor. I'm now going to share my screen, and I'm going to be sharing with you about skid marks. So the first three speakers, nurse clinician Shao has shared with you about how you can try and improve the control of your bladder by training it. Miss Yip has taught you where your core muscles are, and there are actually many muscles involved when we talk about the core. So if you go on YouTube, all you find is somebody doing planking. That's only one muscle, but there's a lot more to it. And all these muscles are useful. Dr. Rana Arus has shared with you how you can help to prevent yourself having problems, having to wake up all the time in the night to pass urine. And as you heard, there are many things that can be causing you to wake up to pass urine at night. And it isn't always just your bladder. It isn't just because you drank too much coffee. So please, if you're not sure, speak to your doctors about it. Now, my talk is, I'm a colorectal surgeon by training. All right, my area of specialty and interest is in bowel control. So obviously, when I say skid marks, I'm going to talk to you about how you can control it. And well, this is picture as an example of a horrible skid mark. Yeah, that is if there is feces staining in your underwear. Now, if you notice some stains in your underwear, there can be a variety of reasons for this. You will worry that, is it because I can't control my anus anymore? It may be, but there's another version where your person is actually constipated and quite badly constipated to the extent that there is a bit of feces leakage around the constipated stool. We call it overflow incontinence. Is it because you're actually not leaking feces, but leaking mucus from the anus? And that can be an issue. But the commonest one is our toilet habit, meaning it's something that we can easily manage and control. So today I want to share with you a little bit of what we will consider a normal type of bowel movement, and then what can cause a leakage of this feces from the anus. What can you do if this happens to you? And are there treatments available for all these conditions? So a quick one on the anatomy of the anus. In this diagram, we have the rectum. The rectum is the storage component of your large intestine. So as all your food is digested, the feces reaches the lowest part of the large intestine is called the rectum. So you imagine that you have a plastic bag. You've got a big bag there. You're going to keep until it's full. And then when it is full, you pass stools out through the anus. But the anus is like a door. The door is controlled by muscles of the anus we call the internal and external anus sphincter, as well as the pelvic floor muscle called, in here is called the levator ani. But these are all muscles that help you close the anus, and then you need to be able to tell it to open the door. So a side view of the anus, the rectum and anus, this is the levator ani, or the innermost part of your pelvic floor muscle. So it helps to create a kink in the rectum and anus junction, and that helps keep us continent when we are walking about or doing our normal activities. So using this diagram on the left, when feces reaches the rectum, the normal thing that will happen is that your internal anal sphincter will relax a bit. The reason is that it needs to relax so that the feces can touch the upper end of the anus, and we have special sensors to tell us whether we are going to pass gas or whether we are going to pass motion. If you think about it, all of you know that. All of you know when it is just going to pass gas and you can let it go, or you're saying, oh no, I think I need to poop. Then you know you have to hold back and look for a toilet, right? So what do you mean by holding back? So let's just say that there's no toilet in front of you. You're not there yet. You have the feeling that there's feces. Immediately now, you will squeeze your external anal sphincter, right? You will clamp down, you hold it tight. And the idea then is that by squeezing it, it pushes the stools back up and you keep yourself continent. Now, you do that and then you walk until you reach the toilet. Now you are good to go, right? You're at the toilet, you sit down, and then you realize, as you relax, what we mean is that you are relaxing your external anal sphincter and the feces can come out. But as the feces comes out, it will leave some feces stains on the side of the anal wall. Okay, the anus appears straight in this picture, but when you pass motion, it opens up. The lower part will open up to allow the feces out, and there'll be stains here. So what do we do after we pass stools? We clean ourselves. But how do we clean ourselves? If you are in a toilet outside your home, often you reach for the toilet roll next to you, like this, right? So we use dry tissue often, okay? The issue with using a dry tissue is that as you clean the anus, it leaves, it creates an irritation to the anus itself because it's abrasive, it's dry. And when it's abrasive and dry, it forces your anus to contract prematurely, so it will retract back into the anus. Okay, your anus lining will pull back up, and some of the feces stain stays in the anus. Okay, so that's one issue. The better option is to use a wet method. So you can use wet tissue because it allows you to clean more. It's less abrasive, it's more comfortable, so your anus doesn't retract so fast. So you can clean more of the feces stain in the anal wall. The best method, of course, is washing. So if you're at home, you use a shower spray, or some people have a bidet, a spray in the toilet, and they can use that, and that helps you wash the anus in the best and cleanest method. But is it always just due to that? The inadequate cleaning after a bowel movement is actually the commonest reason we have stains, okay? So if you see a stain in your underwear, don't panic. It doesn't mean that you're going to have a very serious disorder. Most likely, it is because we didn't clean ourselves in the perfect manner. So if you use only dry tissue, it causes the anus to retract prematurely. As I said earlier, the stains are staying in the anus. You get up, you think that you're clean. But when you walk after that, or if you pass gas, a little bit of the feces stain can now leak out. And that is the one that is the stain that you will notice. So to overcome this, change the way we clean ourselves after we pass stools. First of all, if we can, we should wash. But if we don't have access to the water spray or a bidet, then we may want to use wet wipes. Okay, that allows us to clean the anus better, and you're less likely to stain yourself after you pass stools. Other than our toilet habit, now this part, I hope that you can understand. If you change the way you clean yourself, but you still persist to have a problem, then is it actually because you are leaking mucus? If it is mucus leakage from the large intestine, it can, or from the anus, it can be due to an infection. It can be due to some other source of inflammation. or the worst case scenario, it may be due to a cancer that is causing a lot of mucus leakage. It could actually be due to a weakened anal muscle. Okay, and today I'm not going to share with you about the various causes of weakened anal muscles leading to incontinence, but it is one possible scenario. Lastly, in some patients who have chronic constipation, they may develop some leakage around the anus. And the patients, or rather, if somebody tells you, "Oh, I'm leaking," sometimes for us, the first question is, "How often are you passing stools?" And this has happened on and off. In fact, it happens very frequently in our clinical practice that we see patients with constipation, but they initially present with complaints of these skid marks or staining around the anus. So what can you do? Now, if you have constipation, you should get it treated. Constipation is not a lifestyle choice. Constipation is a medical condition, okay? Sometimes we hear people telling us, "But doctor, if I take the medicine for constipation, I will be reliant on medicine." So I turn around and ask them, "But if your doctor tells you you have high blood pressure and gives you medicine, how come you never ask yourself why you're relying on the medicine?" Right? The reason we give medication to treat patients with constipation is so that they don't develop problems from the constipation. They don't have the bloating, they don't have the pain. In this case, you don't develop leakage. You don't develop pain at the anus, no bleeding, and you're much happier in your life. And the medications that the doctors will tend to use tend not to cause long-term problems. So it's to restore your quality of life. So you got yourself treated for your constipation, or you don't have constipation. Say, is it because of the way you clean yourself? As I said earlier, try and change the way you clean yourself. If you are using dry tissue, use water if you can with a spray. If not, use wet wipes. Let's see whether that helps you. If you find that just changing that, even after a week, you still persist to have this leakage, now you need to ask yourself, is it something else? And this is when you should look for warning symptoms of colorectal cancer. I will share with you in a minute about this. And before you see a doctor, try and fill up a bowel diary. I will also show you an example of a bowel diary. And of course, with those two things, then you can go and see your doctor. So what are the warning symptoms of colorectal cancer I mentioned? So the first one is if you find that your bowel habit has changed from your normal. Now, if you think about it, in this audience, we are all, okay, we're not going to share our bowel habit, but every person has their own normal. And if you're working, the reality is that when you have your coffee breaks, you're not going to share with your colleagues about your bowel habit. These are not coffee topics. Okay, so, but one person might pass motion once a day. Another person might pass motion only once in 3 days, for example. But if each person is well and not having a problem, that is their normal. However, if your own habit has changed, either in frequency, the stool is getting narrow or caliber is different, the color has changed, and it hasn't gone back to your normal for more than 2 weeks, that is a persistent change. Okay, so with a persistent change, that is the commonest warning symptom of colorectal cancer. It doesn't mean that if your bowel habit has changed for more than 2 weeks, it means you have cancer. No, it means there's a chance you have cancer. So you should go and get it checked. Second, if you see blood in your stools, that might mean something going on inside your intestine. It is not just bowel control problem. The third one is this incomplete bowel movement sensation. What it means is you go to toilet, you sit down there and then you poop. But then when you think there's no more poop, but you still feel like something is stuck inside. So there's something there. That feeling of something stuck inside might actually be due to a lump growing inside your rectum, for example, and your brain thinks that you have feces, but actually it's a growth. So you should get that checked. Earlier, I mentioned mucus. So again, if there's always mucus leaking out of the anus, mucus meaning like you look at it, it looks like phlegm, but it's coming out of the backside. That's not good. That might mean something more. It might be a tumor, it might be an infection. Okay, or if when you shower, you'll find that when you check your tummy, when you clean your tummy, you notice, why is there a lump inside? That might be another reason as well. So if you have a change in bowel habit, blood in your stools, incomplete bowel movement sensation, mucus in the stool, or you can feel a lump in your tummy, please speak to your doctor. So this bowel movement diary, you might look at it and say, wow, it is so complicated. Actually, it's free. By the way, I just took this from Google. Okay, I just Googled bowel movement diary, and then this came out. Okay, so it's very easy to use. You can actually use that if you don't have the availability to go and Google. You can ask from your family members or anyone to get a bowel diary, and or you can just use your own piece of paper. Just say, like, for example, for 1 week or 3 days, just write down the date, what time you went to toilet, how hard you think the stools were, and whether you're taking any medicine. And that is to give yourself as well as your doctor an idea of how you have been behaving. Sometimes when we try to recall alone with our memory, it may not be as accurate. Whereas when you write it down, it becomes something a lot more reliable for everyone to look at. So with all the information, see your doctor. Now, if you had symptoms to suggest colorectal cancer, your family doctor or your GP can refer you to a specialist. If he thinks it's constipation, he can help you treat it first. Okay? And then if you see your specialist, then he might do a colonoscopy to rule out colorectal cancer or look for areas of inflammation. And if the doctor thinks that there is a problem with the anal muscles, they can then send you for specialized tests on your anal muscles. So I'm just going to run through very quickly 2 slides about bowel incontinence, or what we call fecal incontinence. Now, losing your bowel control is not a part of normal aging. It is abnormal. Okay, so in every patient with fecal incontinence is treatable. Okay, everyone is treatable. In fact, more than 90% of them do not require surgery to treat the incontinence. Okay, the treatment very often will involve physiotherapy, like what Miss Yip has shared, and it might involve a lot of counseling as well. Okay, changes in our lifestyle, as Dr. Rana Arus has mentioned, and changing the way we clean ourselves. Okay. So the treatment would then allow a patient with incontinence to return to normal activities. And very importantly, if you think about it, if somebody feels that they are leaking, they will feel very embarrassed to share or to go out with other people. And that's horrible, because we are humans, we are social beings. We need to share our days and our lives with those around us, our loved ones. We talk about bowel incontinence treatment in terms of 4 R's. We can retrain your anus through exercise. As mentioned like earlier, somebody mentioned Kegels exercise or pelvic floor exercises. In the anus, we talk about it in terms of combining counseling with the physiotherapy called biofeedback. We can restore the nerves if the problem is in the nerves, meaning re-innervation. We can repair the muscles if they are torn, or we can replace the muscles if they are missing. Okay, but I won't go into all that treatment, but there are treatments available. And 90% of them will only be in this first group. Okay. So in summary, skid bugs or stains can usually be treated because the commonest cause is the way we clean ourselves. So a better cleaning after bowel movement will solve your problem most of the time. However, if you find that there are symptoms to make you suspect colorectal cancer, your doctor. But if you think it's a bowel control problem, either the 2 extremes, either you cannot control, called bowel incontinence, or you cannot let go, called constipation, do a bowel diary and speak to your doctor. There are always treatments available. Okay, and with that, I'd like to thank you all for your attention. I am now going to put the thing back to Mark, and then we'll go to the Q&A session to see whether there's any questions from the floor.
That's right. Thank you, Dr. Lim. And that was Dr. Lim Jit Fong, President for the Society for Continence Singapore. Now, there's a lot of amazing content shared today, and I'm sure that many of us would like to go back to review some of what was shared. So not to worry, we will actually be uploading a recording of this video to the FSCS website, and I've actually pasted the link, the website URL for your reference. So it should be up within the week. Right. Now, before we adjourn for the Q&A, I would like to share another kind word from our sponsors.
Before I used to use ordinary sanitary pad, the leak is quite bad and causes odor. It's really very embarrassing. I started using Tanner Pro Skin pants. It is so comfortable. It absorbs the urine very well. Before I used to use ordinary sanitary pad, the leak is quite bad and causes odor. It's really very embarrassing. I started using Tanner Pro Skin pants. It is so comfortable. It absorbs the urine very well.
Okay, and now it's time for our Q&A. So feel free to pose your burning questions to our panel of experts.
Okay. Thank you, Mark. So to everyone in the audience, we have all the 4 speakers here. And if you have any questions, please feel free to ask us. I think Mark let slip a faux pas earlier because he said that it's all burning questions. I guess that's where we all come in with burning around the bottom when you have urine or power leakage. But yeah, please come to our website if you want to find out more. Speak to your doctors, your GPs, and there are many specialists, by the way. There are doctors and healthcare professionals who deal with all versions of pelvic floor disorders, bowel and bladder control in every hospital in Singapore. Okay, I'm very proud to say that we do have them in every hospital now. I would say maybe 20 years ago, some hospitals didn't have the full complement of all the specialists, but now everyone has. So please do not be worried whether you need to go somewhere far away just to look for a doctor. There's always one near where you are. Okay, since I think many people are shy, maybe I will get the ball rolling to ask our nurse clinician Shao. I think earlier you shared with us about bladder control. Maybe in your own experience, you can share with us maybe 1 or 2 examples of problematic issues when you try to help your patients retrain the bladder. Have there been unusual cases for you?
So actually most of our patients when we treat, most patient is elderly. So maybe they are some is independent, but some need some caregiver. So also some patient got dementia. So a bit difficult to train this group of patient. So they need to have motivation, especially the dementia patient. So we cannot directly, we need to teach the caregiver how to help this group of patient, how to distract them, how to distract this kind of patient, then try to increase their holding time for the urine. Otherwise, a lot of elderly will if you don't let them to go toilet, they will very angry, they will throw temper. So I feel difficulty to train this group of patient.
I think that's a very good point. You brought up about dementia. So dementia often is when a person, as they become older, they lose certain cognitive functions on their brain, meaning they are not able to tell very well, especially about social circumstances. So to the audience, sometimes we have our elderly parents or family members who have dementia. Their problem isn't that they have lost muscles or they can't control, but sometimes they are not aware of the social circumstances. So I will urge all of you to please be patient with them. Please don't shout or scream at them because it doesn't help you, it doesn't help them. Try and understand that they are not aware of the situation, and then find ways and speak to your doctors, find ways. We may need to get the dementia treated, but there are other ways that we can help them to minimize all these problems with incontinence. Our sponsors today are Tana and WellSpec. I will take this opportunity, just a side one, just to thank them for supporting to help us organize this forum. But they both are companies dealing a lot with continence products, and there are many products out there that can help you at home look after your elderly relative who is having problems with incontinence. I'm going to now move on to Miss Yip. Yeah, Miss Yip. So your area of specialty with all this pelvic floor exercise, and if maybe you can share with us. Earlier you shared very good exercises that everybody can start doing, simple things to get the ball rolling and to help you identify whether you have problems, right? If someone has a problem and they want to find out more about core muscles, is there any place that they can go and get information from? Is it there physiotherapy society or somewhere that they can approach?
Yes, so we have Singapore Physiotherapy Association. But I'll be honest and say, I think now in terms of the government funding for community care, maybe somewhere even closer. So usually each residential area should already have some kind of okay, you don't have to sign up for daycare, right? But like things like Gong Wai Siu or St. Luke's, there is usually like centers within the residential areas where you can pay a very, very small fee, like okay, don't quote me, but it might be something along the lines of $10 for 6 months. So my mom has, signed up, and basically at these centers, you can join for social activities, and there are actually free exercises that you can join. So you might find that in my residential area under a random pavilion, how come every Wednesday afternoon got people doing all these Pilates? Then you might find on Friday morning there are people doing Zumba at the void deck. So these are actually all free activities that you can actually have a face-to-face instructor. So if we had this like live, we would have gotten everyone to jump out of their seats in the audience, right? But because it's online, it's the video is the next best thing. But you'll be surprised that actually in your neighborhood that there really will be stuff like this available. If not, actually at your polyclinics, there will be, not all polyclinics have physios, but the larger ones usually will have. Otherwise, they should be able to refer you to, again, a center near you in your residential area that actually runs all these programs for a very, very subsidized fee. Otherwise, it's actually for free. Yeah, so movement really, because now you can see, okay, I hope I managed to inset this in all your minds, right? That everything in your body is connected. The mind is connected to the physical being, you know, but the physical being, the muscles in your head all the way down to your feet are all linked, right? So we love to tell people, okay, yeah, you do your pelvic floor exercise, but you know, for someone who is unable to get the assessment, something as simple as breathing lah, going downstairs for Zumba lah, or if you are very shy and you do have the connectivity at home, getting your grandchildren or your children to go like, hey, Google some exercise videos that you can follow online. Even doing something like that to start off with is helpful. In all honesty, what we are seeing in terms of problems is really these two spectrums, right? People who haven't really been moving, so they're really not quite sure how to turn on muscles. The muscle's not active, so it's not providing input. You know, you've got stool sitting there, but you can't quite tell because the muscles are not supporting. So you don't know there's stuff in your bladder, you don't know there's stuff in your bowels, or you have gone to the other extreme. For certain reasons, you're unable to move around. So you're very tight because you're seated, and sitting shortens certain muscles in certain directions. So then you're unable to let things go well. So if you're not letting things go well, then, you know, like Dr. Rana mentioned, you might be operating at what I call half tank. Then you keep wanting to go to the toilet. Or you might find that, hey, you know, my muscles cannot relax completely because they are also shortened in a sitting position. Then when I'm trying to pass motion, I leave a lot inside the lining, like Dr. Lim mentioned. So then later, poor thing, right? You clean to the best of your ability already. Some people tell me, I spray with the bidet, you know, I spray for 10 minutes already. Still, when I get up and I walk around, you know, I get this kind of like itch in my bum. And sure enough, when I go to the toilet, you see there is something left. So yeah, I think in terms of movement, go to the residential areas. I think the government is doing a good job in terms of making this accessible for everyone. But otherwise, your doctors in the polyclinic should be able to point you in the right direction. If not, Singapore got a lot of greenery, got park connector, go out and move, okay?
Thank you. It's correct.
Dr. Lim, we have a question.
Yes.
From Diana.
Yes.
If a patient has already have senna and lactose medication but still has chronic constipation, what other alternatives can be introduced to that patient?
Yes. Thanks, Mark. Yeah, I noticed that in the chat box. I was about to get to it. So I would say that first of all, this is probably not the best forum to give you a targeted answer. In reality, the term itself, chronic constipation, requires you to be assessed by a specialist to ensure that we are not just dealing with, you're obviously not dealing with a simple regular constipation, because those medications that are mentioned are quite commonly used. And if you need more, there are many other alternatives, by the way. There are many alternatives. But how we choose the alternative really depends on where the doctor finds your problem to be. When we use the term chronic constipation, it just refers to you passing motion less frequently than you normally do. And this has been going on for many months, if not many years. That's all it says, but it doesn't tell us why. So a certain amount of investigation work will need to be done to discover whether there are any other underlying conditions that are contributing to yours, and whether there are other factors affecting you in terms of your lifestyle, stresses, medical conditions, and therefore from there, deciding how best to move forward with your treatment. So that's all I can say. I apologize, Diana, because my take therefore is please speak to your doctor who's been managing you. If he's not a specialist in bowel control or constipation, please get his advice to see who you should consult after that. Maybe if I now move on to Rana, Dr. Rana, thank you again. I enjoyed your talk tremendously, and I think it is very timely to share with the public, because I think many members of the public or patients that I see often are not aware that when we talk about waking up to pass urine at night, they focus on the night and they forget about the day and how their habits have been in the day, because them going to toilet to pass urine in the day is quite normal. So are urinary or rather bladder diaries useful for people to try and keep before they see doctors? And what has your experience been with that?
To be honest, that will be the golden thing, isn't it? Where they come in with the diary, with the information in there, because it's really very useful. But I mean, let alone coming in with the bladder diary, I have a lot of issues convincing them after the consultation to actually do the bladder diary. And I think it's just not myself worldwide. That's generally a challenge. What I would recommend, what we always ask for is a 3-day consecutive bladder diary, where it documents for those 3 days consecutively both rough timings, each time that you actually took in fluids, water or other drinks, what timings roughly aga that you passed urine, did you have incontinence, and when you actually passed urine, did you actually feel the urge to pass urine, or you went there to pass urine because a toilet happened to be nearby? So whether it was the urge that prompted you and how bad was the urgency. We also asked them to document their motion habits as well, because that also affects the urination as well. So ideally, if a patient can bring this at the first consult, actually you are more to stand in terms of benefit, because you are just shortening the whole process and you're coming in and you're more likely to get help faster and care faster if you actually can come in with this. And if you Google 3-day bladder diary even online, it should come up as well. So if you can bring it at the first setting, actually the main person to benefit from this most is you. You'll get answers faster, management faster. But yes, it can be a bit of a challenge. To make it easier, we do in our clinic, some of our patients, we do give them, some kind of a thing, that a bowl of sorts that you can just slot in, and then when you pee, it has a measurement as well. But you don't necessarily need those fancy things. You can just go to the NTUC baking section, for example, buy a jug with the mark, measure your urine, document in any, bladder chart that you can find on Google straight away, bring it to your first consult, you'll benefit. Thank you very much for bringing it up. I think it's very useful.
Thank you. Thank you. I think I am not going to hold our speakers here back anymore. Thank you all for your time today. Thank you for all your expert knowledge and sharing with the public. Mark, if we can share the closing slides. Yeah, so yes, so we are a charity and we are the Society for Continence actually runs purely on volunteers. Every single one of us who are actually in the executive committee and in the board of governors, we are all volunteers. No one is paid, but we do need help to be able to run programs to educate people and to help patients with incontinence. So of course, I am going to do a bit of selling here. So I have a Pay Now QR code here, and any donation to the society is very, very much appreciated, of any amount. Once again, we are an IPC charity, so any donation above the $50 is eligible for tax rebates. And you can scan here to donate. You can go to our website to find out if there's any other way you can help us. Or if you feel that you have some time and energy, we will be more than happy to welcome you as our member in the society and to be a volunteer to help us craft programs for people with incontinence. And with that, I'd like to thank you all. We'll leave this on for about a minute if any of you want to scan this and donate. And with that, I'd like to thank all our speakers, Ms. Shao, Ms. Yip, Dr. Rana. Thank you for sharing your precious time on a Saturday morning. Even better yet, thank you to all the audience for spending your time with us on this precious Saturday morning. I hope you enjoy yourself and you learn something. If you find that you learn something, please share. Please share. Okay. And with that, have a good weekend, everybody.